Officially, hello everyone, this is Michaela Conley, HP CareerNet, Health Promotion Live, and I'm so excited today that we have Diane Hart, obviously, is the president of the National Association for Health and Fitness and co-founder of Heart to Heart Fitness. Today you're going to talk about the Employee Health and Fitness Month, no longer just a day. A day can't hold it. And the other presenter is Brenda Lube, and she's the co-chair of the National Association for Health and Fitness, Maryland State Advisory Council for Physical Fitness, council member, president, founder, Corporate Fitness Works. And Brenda and Diane, I'm really glad that you were able to join us today.
Thank you. Ladies and gentlemen, Brenda and I would like to thank all of our distinguished guests today, Michael Conley and Kelly House, the event manager at HP CareerNet, and their logo is Everywhere in Health Promotion All at Once, and I want to thank you for this opportunity. At this point, I do want to thank my friend and colleague, Brenda Loeb, for taking Employee Health and Fitness Month to record levels, to unbelievable heights. We can all feel a powerful shift in the mindset of employers regarding employee health care and its impact on their respective bottom lines. Current and future spending in employee health is not only unsustainable, but also poses a significant threat to the overall competitiveness of American businesses within the global marketplace. While there can be a number of goals for wellness programs, the most important objectives relate to employees' health awareness and behavior, educating employees about their health status and health risks, and improving behavior patterns that contribute to poor health. It was surprising to learn that the U.S. Chambers of Commerce said it's disturbing that for health promotion in our country, very few programs are available to employers or employees. Employee Health and Fitness Month can definitely fill this void. Brenda and I strive to be creative in our best practices and evidence-based approach to the survivor workforce of today and to satisfy the new needs of this workforce with surprises that help them deal with their daily struggles. Brenda and I proudly today introduce Employee Health and Fitness Month, created by two nonprofit organizations. And the National Association for Health and Fitness, and that slide is up now, our members have been leaders in presenting capacity building, national meetings, developing user-friendly behavior change programs, recognizing excellence in advocacy for policy and environmental support of active living. With our focus on the states, NAHF bridges the gap between federal and local action and unites researcher and community practitioners. ACTIVELife. This is an Austin-based nonprofit company. We met them and aligned with them at our summit last year in Austin, Texas. They have many allies, including Austin Fit Magazine. They're achieving a focus on health rather than illness, and they're extremely influential in our country in changing the landscape for better health. It's a real honor to be partnered with them for this event. So what is this? Employee Health and Fitness Month. We invite you and your organization as stakeholders to embrace this best practices initiative, to improve or supplement your current health and wellness status, or to implement this as your total design package. Considering the impact that health status has on an organization's performance, employee wellness is a critical factor to an organization's short and long-term success. It clearly gives you a competitive advantage. It's free, totally free. You can even use our logo in your internal offerings. And it's supported by a state-of-the-art interactive website, which we launched on Wednesday of this week. This was formerly National Association for Health and Fitness, Employee Health and Fitness Day. And we wanted to extend it to a month-long initiative in an effort to generate ability for a healthy lifestyle and to initiate healthy activities on an ongoing basis. It's held during the month of May, but you could choose your own month if you're not ready at this point. And given that healthcare costs follow changes in individual health risks, a healthy workforce and a supportive culture of health in the workplace needs to be part of a company's mission and vision statement. These healthy moments that we're referring to here can be even as simple as going to your dentist, taking charge of your health. And the healthy groups assist in our sustainability. That culminating project can be throughout our whole community or company. And it can be like growing a garden together. And what's important is that we can give you the data to reinforce the view that employee health is a productivity strategy rather than a health care cost management. Brenda.
Thank you, Diane. Now, you might ask yourself, why did we change it from a day to a month? And those of you that are health professionals knows that research has shown that minimally it takes 6 weeks to 6 months to change a health behavior. Well, we thought that why not, for the first time that we're aware of, from all the National Health Observances programs across the United States, we're going to initiate a month-long initiative. So we decided to partner, as Diane said, with ACTIVElife to initiate a program that can be used month-long instead of a one-day for the month of May. The other reason is sustainability. To generate sustainability for a healthy, active lifestyle, we wanted to provide resources that can help you as the practitioner and coordinators of programs to be able to have resource to do such a program that will sustain healthy behaviors. You can register anytime, and this initiative can help you kick off such an event. Diane, next slide.
Yeah.
So why celebrate Employee Health and Fitness Month? Really to promote positive behavior, positive health practices, and give you an opportunity to make it a norm, a normal behavior within the workplace where people spend most of their day. So it's an opportunity to meet other worksite health practitioners such as Diane and I that can support you as well during this sustainable, hopefully permanent behavior change program. Next. So ACTIVElife has this program called Domain Healthy Week, and really what this is the kickoff to Employee Health and Fitness Month. And one of the things I wanted to mention, which I didn't, it used to be called National. Well, we changed to Employee Health and Fitness Month because we've had requests, believe it or not, to make this an international event. So we're very fortunate that we've got an online program that now we can open this up globally to countries as well. So Domain Healthy Week is the kickoff for this event, and Diane will talk more about the healthy moments and what this means as far as getting your employees engaged into an activity or a program, whether it be healthy recipes or a healthy lunch or a walk. Next. So what are the benefits to health organizations? And if you look at from an employer perspective, and a lot of you probably know the benefits, but let me just reiterate some of them, is to increase productivity, job satisfaction, reduce absenteeism, sick leave, injuries, increase presenteeism, hopefully impact health care costs. And we really do know that a healthy employees equal healthy companies equal the competitive advantage. Because what's the greatest asset of a company but their employees? And without healthy employees, how can the company be productive? Next, from a employee perspective, what are the benefits? Well, we know that this program will improve overall health and well-being, help employees reduce stress, improve work-life balance, improve level of physical activity, which now the norm is 30 minutes of daily physical activity each day of the week. So it becomes a permanent behavior, increase self-esteem and self-image, improve the importance of health, increase energy, help with the issue of weight gain, improve the overall energy balance, raise the whole health awareness. And to me, I think one of the most important things is to reduce the risk of the leading cause of death, which is heart disease for both men and women. So we're helping employees understand the importance of their blood pressure, weight gain, cholesterol, blood sugar, diabetes to reduce heart disease. Next. So, and the next slide after that. And so one of the things that I really want to point out is that this is a structured, sustainable, sound result program that can really impact your employees and your culture. And the new trend now is healthy cultures. So a program like this, if you're not doing anything in the area of employee wellness or worksite health promotion, this program can help initiate healthy culture for your company. And I'm hoping that through this program, that wouldn't it be nice if we can initiate from a program like this to start physical activity policies within companies today. I would like to put that out there to all of you to help us create such a policy. And then everything you need to plan, organize, implement, and evaluate Employee Health and Fitness Month is here for you. Plus, this health and worksite health practitioners are here to provide resources to help you with this program. Next. Now, so how do you participate? It is so easy because now we have for the first time, and this is the first time for this program, that it's virtual. So you go on the website, which is healthandfitnessmonth.org, to register. And we ask to register the employer groups as well as individual employees will also register. So the message here is to get everyone to register so we can track the data necessary, because we hope that Diane and I will have an opportunity to present the statistics related to this program for future conferences. So it's everything you need. There's a free toolkit, and you have access to health professionals such as Diane and I, which are here to help you. Next.
And the moments groups and projects. This is Diane again. The website will have support. I will give you an email address for the webmaster for that if you need a step-by-step way to register. And individuals are also encouraged to sign up. They can designate their own activities because they might not be affiliated with an organization. So the moments, groups, and projects. This helps you as an employer or as part of a coordinator of a wellness team to relate on a purely human level to an extremely daunting task of getting us all on the same page. So difficult to relate to individuals. Everyone has their own individual goals. But success with this participation, and we can give you that data, can remove some of the perceived barriers voiced by employers in offering health promotion programs. The participation is an important metric. That's an important part of what we can give you, and that will encourage the powers that be to have sustainability for these projects and to have it develop as a company policy that it will be a wellness company. The healthy moments. Last year, at the end of this initiative with ACTIVELife, on May 5th, 2010, one day, we asked people in places across the country via the internet to show their support for healthy, active lifestyling by creating and sharing moments. And are you ready for this? By the end of that one day, nearly 90,000 healthy moments had been organized and shared in 43 states. Office picnics, community-wide run walks, and for one incredible day, we were all unified in our mission to build a healthier community. And we knew at that point that we wanted to take, and then again, National Employee Health and Fitness Day, we wanted to align with Active Health and incorporate these healthy moments in our organization as well. And again, Brenda and I were talking about the example of healthy moments. We find when we go into workplaces that The creativity comes from the people right in that building. We give them ideas and how cute it would be to do blood pressures and everything and exercise classes, but we find the most creativity comes from you, the people that are on this call. So again, we don't have all the answers, and we're looking forward to when you register and register your healthy moments and ideas, what we're going to come up with. There's no barrier to what we can do. So the healthy groups. And a couple of people that may be on this call even contributed to this slide. One person said they just started turning music on at lunchtime and just started moving around. Some people might be a little embarrassed to do that, but some people were very successful with that. And just burning those few calories, doing chair squats and jumping jacks in your chair. It's always a fun thing to do with a group. And it gets you laughing, and the stress level goes down. So this culminating project we talk about, you don't need to reinvent the wheel. You have plenty of community 3Ks or 5Ks, American Heart Association walks, American Breast Cancer Association walks, and things of that nature. Just align your team with already existing and start small. Don't reinvent everything. Of putting together a 5K race, Brenda and I have done it. That's quite a daunting task. So join right now with what you've got existing in your community, and that just ties everything together. So well-lit, accessible stairways, that's a big thing that's come apart from all of this culminating projects. The stairwells and signages that encourage you to use the stairs versus the elevator. And again, we see unbelievable creativity in the workplace. This appreciation is for Baker Harrell, the founder and CEO of ACTIVELife. He has really started this ACTIVELife movement within the state of Texas, and it's spread well beyond the borders now. And we are honored to partner with him in this entire arena of workplace wellness. Brenda and I realize that there's nothing out there like what we're offering today, and it's free, absolutely free. So that helps self-funded companies that are self-insured and companies that are too small to bring in high-powered wellness coordinators. They can go onto this website and have an entire program designed for them. Any additional information we wanted this slide available to you so that you could go to this. And before I get into the National Physical Activity Plan and how this ties in with that nationwide initiative, I'm just going to go back to Brenda to see if she'd like to add anything at this point.
No, I think that we want everybody to know, I guess I do have a few comments. We want everybody to know that this is the first year for this program and that it's our first year. We're obviously going to grow this program, and we look forward to creating the masses of employer groups in the U.S. and abroad to help develop this program. So we're really looking for each of you to help us with strengthening this program. All of you who are coordinators of this program, we look to you to hopefully volunteer in the future if you want to be part of enhancing it for years to come. We're actually, matter of fact, I'm getting calls from people who are interested in volunteering to help enhance it because this is, like I said, the first of its kind. So that being said, Diane, did you mention about the sponsorship as well?
Yeah, I was going to go into the sponsorship. For this year, it's not too late if you would like to be one of our sponsors. Also, in January and February of next year, we're going to start to begin and enhance some training programs for coordinators and also for work sites that may need some help with development and implementation. And we will accept sponsors also for that, and for any time that we are presenting on a national stage, you can be included in that as well. Again, feel free to use our logo. Not a problem with that on any of your internal efforts, and we hope you'll keep us apprised of anything that you're doing. So, again, still looking for sponsors in that arena. Okay, Brenda? We're good?
We're good.
Good. Okay, excellent. All right, so going to the plan. In the development of the entire Employee Health and Fitness Month, and because I was lucky enough to be one of the strategy leaders down in Washington with the development of this plan, I realized how amazingly all the protocols for what was developed with Employee Health and Fitness Month fit into the National Physical Activity Plan. And this plan is a public and private call to action by the Center for Disease Control. We're developing a comprehensive, coordinated, and focused national policy agenda. Remember, I spoke to the fact that we all need to be on the same page. We're trying to get through these self-initiatives in the workplace, plus this National Physical Activity Plan, all facets of American culture unifying behind a single plan and a single initiative to increase physical activity throughout our population. This is led by the Prevention Research Center of the University of Southern California and Carolina. What's different about this? Many of you have seen, we've had Healthy People 20, 2000, 2005, 2010. And what's different about this, what I love about it, is that it does not have a research agenda as the priority. Most of you as practitioners know that a lot of what's been done in physical activity, it has to do with the research arm of what we do. This is not research-driven. Education and support of people like us, organizations and society as a whole, on how to become more physically active is really the basis for this. So the 8 common strategies and high-level plans, all our protocols fit into every single one of the high-level common strategies that are being addressed right now in our government and by our country. So right now we're on phase 4, which establishes a unified brand and broad awareness for physical activity. And you can see it from television commercials to more information from your personal physician to you, that this awareness is increasing, definitely increasing. In fact, for Employee Health and Fitness Month, we have asked governors of many states and have received 3 proclamations already declaring this month of May to be Employee Health and Fitness Month. So we are working through the legislature and through our governors to also increase advocacy and to create legislation as well. So I thought this would be a great thing to put in at the end because it fits in perfectly from bottom to top and top to bottom with what we need in our country. So again, what we do, as you know, every day is a living, evolving process. And we've thought this through, and I will tell you I have never partnered with a better organization than ACTIVElife and also with Brenda Loeb, Corporate Fitness Works. And we need your help today on the call to be part of what we're trying to do to change things for the better.
Thanks, Diane. Wonderful. If you have questions, please do type them into the box. So do you want to go ahead and talk about the website?
Okay, do you want to, let's see, we can bring that up, and we can give them an overview of that. And I want anyone on the call right now, I'd like you to take down the email address of the webmaster. He was unable to be on today, but he states that he would love to receive any questions, but he's hoping that there won't be really any questions, that it's going to be so easy to navigate that maybe there won't be any questions from participants. So I'll give you that email address if you're ready.
I'll just type it into the chat box for them.
Yeah, I'm still looking for that.
Nice.
John at activelife.hq.org. John at activelife.hq.org.
Okay.
For some reason that's not coming up. Okay, I'm seeing the notes at the top. Brenda, do you see those?
Mm-hmm.
Okay, do you
Yes.
want to take it? Okay.
As far as what? I don't see.
Questions?
I'm sorry?
Would you like me to just read it to you?
Yeah.
Okay. Kelly would like to know if there's a reason why you waited so late, being April 29th for this webinar. It would have been helpful to introduce it in mid-April so that they could plan ahead. I know the answer. I'll let you take it.
Brenda?
Diane, do you want me to take that?
Yes, I do.
Absolutely right. Our intention was to start a lot earlier, because of dealing with, obviously, a board and working with putting an RFP out for potential technology partners, we got delayed. And because of that, obviously, the timeline did not turn out the way we wanted it, and that happens a lot of times when you start a new initiative. So that's why we're stressing the fact that this is our first year. It's a kickoff, and already, to be totally honest, it's so much better than the years past. So we apologize from the standpoint of being not the kind of timeline you would expect from program coordinators, but we're hoping that this will be the launch pad to improve this in years to come. So great question. Thank you.
Just building on that slightly, I feel that we didn't want to wait until next year when we could have more time to launch it. This is such a good product that we didn't want to deprive the workplaces for this. So you have a month now, and hitting the Employee Health and Fitness Day was always a challenge in the past. So at least now we have a month or even 2 months. And we're going to find out how long the web will support that website so that we can absolutely support longer-term initiatives. Good question, Kelly.
Yeah, and I think it makes total sense, and certainly launching in this way wouldn't have been your first preference, but it gives you the opportunity to allow people sort of first look into it in sort of a soft launch, so and comment, contribute, and by the time this time next year rolls around, it should be way ready to rock and roll. Right.
And majority of the work is done. Now we're going to build on our successes and strengthen it, like you say, Michaela. So I'm so excited that we did this, even though it was a shorter time frame than what we really wanted. But it is really far exceeds what we've ever had, and it's really going to help so many companies to launch something new that they've never done before and give them the online capability which we've never had. Because remember, prior to this program, it's all been paper-driven. So now we've got a virtual program that all the remote locations can now participate, which was a issue for a lot of employer groups where a lot of the employees were dispersed. So now they all can be under one program, which I think is exciting.
Maybe you could talk about the website. The first thing that I see is that nice Google map with the activities that people are doing actually showing up as push pins on the map. I think that's pretty cool.
Again, ACTIVELife was instrumental in this development, and it's state-of-the-art as far as we're concerned, and it can give you an overview at any time. If you look at your city and the state, you can see what type of activity, and they give you some examples on the first page, and everyone can see this okay, I hope. They have like a walking group, Q Source, and this Margaret Wells said this was going to be a movement, because the categories are the moments we talked about, the movements, and the groups, and the healthy moments. So, we can just log those, and you can get some great ideas from people. So I think it's educational. And again, total people for the stats for activities, 81,000. That's quite a bundle of people. And again, the more stats we have, the more pre and post data we have on any worksite wellness initiative, the more receptive the powers that be will be to continue. Not just because of healthcare costs or the reduction of healthcare costs, because it creates a healthier company.
It's almost as though that you could use this website sort of, I forget, one of you said that it doesn't even have to be during the month of May, but you could use this on planning, employee activities and such, which would be, a great tool. For free is amazing.
So if you go through, it's easy to navigate. You register, and I can also forward to participants the step-by-step guide as well. and the toolkit is all there, everything that you need to create. And the allies that we have.
I know a question that
Yes.
would probably come up would be when you register, does that mean you're going to be put on some list and you're going to start getting lots of unsolicited email?
The only emails you will receive are reminder emails as to the day of that you intended to do your healthy moment, or the day that you intended to start the walk that you're going to go on. You'll get a little reminder. And I loved that when I was part of this movement last year, that on the day that I said, because again, last year it was just one day, I said I was going to go take a walk with my weighted vest, and I got a reminder that morning, and I was like, oh, I'm so busy, I can't do it. And it was like, you can't get out of this, basically. This is your reminder, and you need to stop and do this for yourself today. So what I loved about that is I didn't get on solicitation lists or spam emails. I just started to receive reminders for my own personal health and fitness and wellness.
That's built in. What a great tool, you guys.
Yeah, just that's built in. The reminders are built in because people go through their day, and all of a sudden at the end of their day, what? I haven't done anything. I didn't even have a healthy lunch. I didn't have any lunch. So it's a reminder that you need to prioritize those tasks in your life. So that's a good question, Michaela. That's a very good question. It's not unsolicited mail. Definitely not.
Yeah, that's
we
great.
treasure the people that are our participants.
Wonderful. Let's see. Do we have more questions?
See, I'm looking at, the home page. And so, again, you'll have to read questions to me because I'm unable to see that.
Okay.
I'm doing my best here to try to find it. It's not showing.
No worries.
Okay, thank you. I know this was really great. We still have a lot of participants on the calls. We thank you for taking part of your day for us.
I think it'd be really great to see this map. I don't know. I love this map. It would be great to see it sort of popping up all over the country, different things.
Mm-hmm.
So maybe you could even, I wouldn't want to put words in your mouth, of course, but maybe you could even challenge all the people that are on the webinar today to create one event, even if it's, their family this weekend. Just one event to add to this, just to see, the impact we can make on this cute calendar.
On this map.
Not to mention the benefits of actually making that, doing that event. Sort of,
It's a great idea, Michaela. I would
great challenge.
that.
Yeah, I'm going to do it.
Good. Good. And, and like you said, the influence that this has on family, the community, as well as the workplace. So we hope that this positive movement in healthy behavior is going to really get more and more people thinking about their health and taking better care of themselves.
And the moments, I loved that because I know many people on this call have been involved in 8-week behavioral modification walking programs at the work site. And many employees today, they want more. They demand more than just that with the pedometers. Although they're wonderful initiatives, we need something different. The workforce today, as I said, is facing challenges that I've never seen them face before. So with this, the little moment could be, I choose a healthy salad dressing.
Right.
Versus heavy creamy dressing. Something simple as that can start that behavior change, that chain of change that we talk about. So the moment doesn't have to be, oh, I'm going to run 5 miles after work today, because we think that's not going to happen for a lot of people. But can you make those small, tiny, incremental changes to change your life and your thinking about your health?
And Diane, in relationship to what you said, one of the other ideas, which I think back to policy and trying to incorporate change at the workplace, what if the employees develop the commandments of a healthy workplace?
Workplace.
So just like you're saying that, and this could be ongoing to get people aware of how they can change their lifestyle through small incremental steps, like you're saying, just looking at the salad dressing or reading labels or bringing their sneakers to work to do a 5 or 10-minute walk, or taking every 45 minutes, taking a break away from their computer, or drinking more water. I mean, it goes on and on. So what if we start these health commandments at the workplace, and they're posted on the intranet of the corporation? So that's another idea to improve or enhance the culture of these different companies.
I talked briefly about the competitive advantage it gives you to have a healthy workforce.
Right.
And Brenda mentioned the presenteeism, and there's a lot of buzz about that today, so that you're at work, not only at work, but you're actually at work performing at your optimum capacity. Mm-hmm. And what that translates to is the return on investment for every employer-sponsored health promotion program at work. That returns dollars and cents. The lowest ROI I've ever seen is a 3-to-1 ratio. They're more like 6, 7 to 1. Mm-hmm. And right now we talk a lot about, right, Brenda, about insurance costs. And I'm trying to get the focus a little bit away from that and more on the productive employee, which will mean less absenteeism, less insurance. That'll take care of itself if you focus on the employee and the lifestyle of that employee throughout the day. Again, I love the top-down, bottom-up concept of this initiative because it does tie in with every other resource that we could possibly get behind us in this initiative. From the largest universities, and a lot of us don't have the resources to get to those funds. So, all that research is embodied in this initiative for you.
I think it's really great.
Thank
you,
Michael, for your support.
Oh, you're welcome. I didn't really understand the incredible flexibility that you guys have built into this to be able to do literally, something very small, like you said, salad dressing, or, or get a group together at lunch and walk the grounds or walk a few city blocks, whatever, or really, it could be a much larger community initiative.
Right.
I think it's amazing that, as we all know, but often isn't reflected in programming, it all counts, Mm-hmm.
And the competitive spirit, that camaraderie that exists in every workplace, we've seen that. Brenda and I have seen people rise to these challenges of, logging your walking steps so that you actually cross the country or cross your state in a certain length of time, and which team is going to get there. You wouldn't believe what I've seen people do for a water bottle, literally. They've changed their lives for a water bottle, for a key tag, just to be part of something like this. It just gives them another reason to be there at work. And they can also do a dual thing of taking care of themselves and reinforcing the health of their company.
Yeah, I think it's awesome.
And Michael, one of the things that Diane and I want to make sure that we say is that our personal email is listed on the title page of this presentation, and that we welcome you to email us if you have any questions, if you want to volunteer, if you want to consider sponsorship now or in the future. Please connect with us, because we really like to develop a larger volunteer committee for next year. And already people that helped this year are going to be involved next year, so we're having some continuity with our committee. So please email us, and on the subject line put Employee Health and Fitness Month so we know. And we are going to collect other health professionals that like to be part of this initiative and grow it for next year.
Oh, here's a question for you. Have you connected at all with the state and all their physical activity plans? Seems like it would fit in so well with what the different states are doing, focusing on physical activity and environment and such.
I know that.
You want to talk about New York?
I can talk about New York. I know that the EAP coordinators for New York State and the Heart L listserv are all in support of this. They've all put it on that Heart L listserv that we were having this webinar today and about the website. I've worked with New York State Health Department for quite a number of years, and this is something, again, that's missing. We had a very paper-driven worksite wellness initiative several years ago, and now with the onset of Employee Health and Fitness Month website, plus supported also by Twitter and Facebook, you know, we have that as well, the social networking sites to enhance this web. The state can link in a little bit easier with us. Obviously, the states are under a lot of economic constraints, and what happens, we found, I know Brenda and I in our lives, we found that when there's a vacuum or a void because of lack of resources in a state or even in the United States, we see not-for-profits stepping up every time to fill that void, to say we're citizens of this world and we need to do this, we need to partner, we need to use all our best resources and our brains to connect people. And that's the thing that Brenda and I do the most, is connect people. And with doing this, just like today, when we met Michael in Washington, D.C. at the U.S. Chamber meeting, this was a natural evolution of our meeting. Had we not been there, had we not tried to connect, this webinar probably wouldn't exist today. But we're trying to offer this free, and I think that's part of what we do as not-for-profits. We fill that void. If there's no money, we've heard that a million times. It never stops us, never.
And one of the things, let me just tell you from the state of Maryland, because I'm involved with the Maryland Governor's Council on Physical Fitness, to that question about the state physical activity programs, we did not this year, but we plan to next year, is to connect with the physical activity coordinators for each of the states. I know who does that in Maryland, and I sent that, but we've got to get that database so we can market this to the Department of Health and Human Services, and in the state of Maryland it's including mental hygiene. So they're aware of this, and so we can connect the dots. So great point. We need to engage them as well as all the fitness councils and the public health departments for each of the states. So that's our next initiative, to reach out to those groups.
They're all aware of us, and I think a lot of times because of the focus always on budgets and money, they lose sight of what they're able to do with the not-for-profits. So we're definitely on their radar with all the states. And we have personal relationships. And now there's only 13 actual governor's councils across our country. The rest of the states are represented by people like me and Brenda on the state councils, and I'm on Be Active New York State. So again, people step up to fill those voids if the governor at that point in time doesn't feel that a governor's council on lifetime sports, fitness, and health is not a doable thing in that state. So a little bit of the background politically for that is it changes, the governorship changes. So some strides that we make under one leadership sometimes is lost with the new governor coming in. So these are some of the challenges that we face.
Great. Well, let's see. Any other questions, comments, thoughts, feedback from the audience? I really appreciate you guys being here today. And I'm so glad that I'm glad the timing worked so that we could at least start talking about it, get the ball rolling, and hopefully, make this the jumping off point. So by the time next year rolls around, it's going to be awesome. And we're all going to be involved in it.
And when we start instituting the trainings, we'll include everyone.
Great. Awesome.
Thank you, Michaela.
Thank you.
Oh,
Michaela.
you're welcome. Thanks for being here.
And I chatted. I chatted.
So funny.